Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is valvular heart disease questions. Without delay, let's get started.
A pulmonary artery catheter is inserted in a client with severe mitral stenosis and regurgitation. The nurse administers furosemide, Lasix, to treat pulmonary congestion and begins a nitroprusside, nipride, drip per physician prescriptions. The nurse notices a sudden drop in the pulmonary artery diastolic pressure and pulmonary artery wedge pressure. The nurse should first assess 1. 12-lead EKG, 2. Blood pressure, 3. Lung sounds, 4. Urine output. The correct answer is 2. The nurse should immediately assess the blood pressure since nipride and Lasix can cause severe hypotension from a decrease in preload and afterload. If the client is hypotensive, the nipride dose should be reduced or discontinued. Urine output should then be monitored to make sure there is adequate renal perfusion. A 12-lead EKG is performed if the client experiences chest pain. A reduction in pulmonary artery pressures should improve the pulmonary congestion and lung sounds. 3 days after mitral valve replacement surgery, the client tells a nurse there is a clicking noise coming from the chest incision, and the incision seems to be becoming larger. The nurse's response should reflect the understanding that the client may be experiencing which of the following? 1. Anxiety related to altered body image. 2. Anxiety related to altered health status. 3. Altered tissue perfusion. 4. Lack of knowledge regarding the postoperative course. The correct answer is 1. Verbalized concerns from this client may stem from anxiety over the changes in the body after open heart surgery. Although the client may experience anxiety related to altered health status or may have a lack of knowledge regarding the postoperative course, the client is pointing out the changes in the body image. The client is not concerned about altered tissue perfusion. In preparing the client and the family for a postoperative stay in the intensive care unit after open heart surgery, the nurse should explain that 1. The client will remain in the ICU for 5 days. 2. The client will sleep most of the time while in the ICU. 3. Noise and activity within the ICU are minimal. 4. The client will receive medication to relieve pain. The correct answer is 4. Management of postoperative pain is a priority for the client after surgery, including valve replacement surgery. The client and family should be informed that pain will be assessed by the nurse and medications will be given to relieve the pain. The client will stay in the ICU as long as monitoring and intensive care are needed. Sensory deprivation and overload, high noise levels, and disrupted sleep and rest patterns are some environmental factors that affect recovery from valve replacement surgery. A client has returned from the cardiac catheterization laboratory after a balloon valvuloplasty for mitral stenosis. Which of the following requires immediate nursing action? 1. A low, grade 1 intensity mitral regurgitation murmur. 2. SpO2 is 94% on 2 liters of oxygen via nasal cannula. 3. The client has become more somnolent. 4. Urine output has decreased from 60 milliliters per hour to 40 milliliters over the last hour. The correct answer is 3. A complication of balloon valvuloplasty is emboli resulting in a stroke. The client's increased drowsiness should be evaluated. Some degree of mitral regurgitation is common after the procedure. The oxygen status and urine output should be monitored closely, but do not warrant concern. Before a client's discharge after mitral valve replacement surgery, the nurse should evaluate the client's understanding of post-surgery activity restrictions. Which of the following should the client not engage in until after the 1-month post-discharge appointment with the surgeon? 1. Showering. 2. Lifting anything heavier than 10 pounds. 3. A program of gradually progressive walking. 4. Light housework. The correct answer is 2. Most cardiac surgical clients have median sternotomy incisions, which take about 3 months to heal. Measures that promote healing include avoiding heavy lifting, performing muscle reconditioning exercises, and using caution when driving. Showering or bathing is allowed as long as the incision is well approximated with no open areas or drainage. Activities should be gradually resumed on discharge. An elderly client with diabetes who has been maintained on metformin glucophage has been scheduled for a cardiac catheterization. The nurse should verify that the physician has written a prescription to 1. Limit the amount of protein in the diet prior to the cardiac cath. 2. Withhold the glucophage prior to the cardiac catheterization. 3. Administer the glucophage with only a sip of water prior to the cardiac catheterization. 4. Give the glucophage before breakfast. The correct answer is 2. The nurse should verify that the physician has requested to withhold the glucophage prior to any procedure requiring dye, such as a cardiac catheterization, due to increased risk of lactic acidosis. Additionally, the drug will usually be withheld for up to 48 hours following a procedure involving dye, while it clears the client's system. The physician may prescribe sliding scale insulin during this time if needed. Regardless of how or when the medication is administered, the medication should be withheld. The amount of protein in the client's diet prior to the cardiac catheterization has no correlation with the medication or the test. A client has mitral stenosis and will have a valve replacement. The nurse is instructing the client about health maintenance prior to surgery. Inability to follow which of the following regimens would pose the greatest health hazard to this client at this time? 1. Medication therapy. 2. Diet modification. 3. Activity restrictions. 4. Dental care. The correct answer is 1. Preoperatively, anticoagulants may be prescribed for client with advanced valvular heart disease to prevent emboli. Postoperatively, all clients with mechanical valves and some clients with bioprosthesis are maintained indefinitely on anticoagulant therapy. Adhering strictly to a dosage schedule and observing specific precautions are necessary to prevent hemorrhage or thromboembolism. Some clients are maintained on lifelong antibiotic prophylaxis to prevent recurrence of rheumatic fever. Episodic prophylaxis is required to prevent infective endocarditis after dental procedures or upper respiratory, gastrointestinal, or genitourinary tract surgery. Diet modification, activity restrictions, and dental care are important. However, they do not have as much significance postoperatively as medication therapy does. Good dental care is an important measure in reducing the risk of endocarditis. A teaching plan to promote good dental care in a client with mitral stenosis should include instructing the client to do which of the following? Select all that apply. 1. Brush the teeth at least twice a day. 2. Avoid use of an electric toothbrush. 3. Take an antibiotic prior to oral surgery. 4. Floss the teeth at least once a day. 5. Have regular dental checkups. 6. Rinse the mouth with an antibiotic mouthwash once a day. The correct answers are 1, 4, and 5. Daily dental care, including brushing the teeth twice a day and flossing once a day, and frequent checkups by a dentist who is informed about the client's condition, are required to maintain good oral health. The client can use a regular toothbrush. It is not necessary to avoid use of an electric toothbrush. Taking antibiotics prior to certain dental procedures is recommended only if the client has a prosthetic valve or heart transplant. It is not necessary to use an antibiotic mouthwash. A client with aortic stenosis has increasing dyspnea and dizziness. Identify the area where the nurse would place the stethoscope to assess a murmur from aortic stenosis. Choose option 1, 2, 3, 4, or 5 from the picture. The correct answer is option 1. The stethoscope is placed at the second intercostal space right of sternum to assess the aortic area as seen in option 1. Option 2 is a pulmonic valve area. Option 3 is Erb's point. Option 4 is a tricuspid valve area. And option 5 is the mitral valve area. The nurse should teach the client who is receiving warfarin sodium that 1. Partial thromboplastin time values determine the dosage of warfarin sodium. 2. Protamine sulfate is used to reverse the effects of warfarin sodium. 3. International normalized ratio is used to assess effectiveness. 4. Warfarin sodium will facilitate clotting of the blood. The correct answer is 3. INR is a value used to assess effectiveness of the warfarin sodium therapy. Partial thromboplastin time is used to assess the effectiveness of heparin therapy. Fresh frozen plasma or vitamin K is used to reverse warfarin sodium's anticoagulant effect, whereas protamine sulfate reverses the effects of heparin. Warfarin sodium will help to prevent blood clots. A client is scheduled for a cardiac catheterization. The nurse should do which of the following pre-procedure tasks? Select all that apply. 1. Administer all prescribed oral medications. 2. Check for iodine sensitivity. 3. Verify that written consent has been obtained. 4. Withhold food and oral fluids before the procedure. 5. Insert a urinary drainage catheter. The correct answers are 2, 3, and 4. For clients scheduled for a cardiac catheterization, it is important to assess for iodine sensitivity, verify written consent, and instruct the client to take nothing by mouth for 6 to 18 hours before the procedure. Oral medications are withheld unless specifically prescribed. A urinary drainage catheter is rarely required for this procedure. For a client who excretes excessive amounts of calcium during the postoperative period after open heart surgery, which of the following measures should the nurse institute to help prevent complications associated with excessive calcium excretion? 1. Ensure a liberal fluid intake. 2. Provide an alkaline ash diet. 3. Prevent constipation. 4. Enrich the client's diet with dairy products. The correct answer is 1. In an immobilized client, calcium leaves the bone and concentrates in the extracellular fluid. When a large amount of calcium passes through the kidneys, calcium can precipitate and form calculi. Nursing interventions that help prevent calculi include ensuring a liberal fluid intake, unless contraindicated. A diet rich in acid should be provided to keep the urine acidic, which increases the solubility of calcium. Preventing constipation is not associated with excessive calcium excretion. Limiting foods rich in calcium, such as dairy products, will help in preventing renal calculi. Which is the most important initial post-procedure nursing assessment for a client who has had a cardiac catheterization? 1. Monitor the laboratory values. 2. Observe neurologic function every 15 minutes. 3. Observe the puncture site for swelling and bleeding. 4. Monitor skin warmth and turgor. The correct answer is 3. Assessment of circulatory status, including observation of the puncture site, is of primary importance after a cardiac catheterization. Laboratory values and skin warmth and turgor are important to monitor, but are not the most important initial nursing assessment. Neurologic assessment every 15 minutes is not required. The most effective measure the nurse can use to prevent wound infection when changing a client's dressing after coronary artery bypass surgery is to 1. Observe careful hand washing procedures. 2. Clean the incisional area with an antiseptic. 3. Use pre-packaged sterile dressings to cover the incision. 4. Place soil dressings in a waterproof bag before disposing of them. The correct answer is 1. Many factors help prevent wound infections, including washing hands carefully, using sterile prepackaged supplies and equipment, cleaning the incisional area well, and disposing of soil dressings properly. However, most authorities say that the single most effective measure in preventing wound infections is to wash the hands carefully before and after changing dressings. Careful hand washing is also important in reducing other infections often acquired in hospitals, such as urinary tract and respiratory tract infections. A client experiences initial indications of excitation after having an IV infusion of lidocaine hydrochloride started. The nurse should further assess the client when the client reports having 1. Palpitations. 2. Tinnitus. 3. Urinary frequency. 4. Lethargy. The correct answer is 2. Common adverse effects of lidocaine hydrochloride include dizziness, tinnitus, blurred vision, tremors, numbness and tingling of extremities, excessive perspiration, hypotension, seizures, and finally coma. Cardiac effects include slow conduction and cardiac arrest. Palpitations, urinary frequency, and lethargy are not considered typical adverse reactions to lidocaine. A client who has undergone a mitral valve replacement has persistent bleeding from the sternal incision during the early postoperative period. The nurse should do which of the following? Select all that apply. 1. Administer warfarin. 2. Check the postoperative CBC, INR, PTT, and platelet levels. 3. Confirm availability of blood products. 4. Monitor the mediastinal chest tube drainage. 5. Start a dopamine drip for a systolic BP less than 100. The correct answers are 2, 3, and 4. The hemoglobin and hematocrit should be assessed to evaluate blood loss. An elevated INR and PTT and decreased platelet count increase the risk for bleeding. The client may require blood product depending on lab values and severity of bleeding. Therefore, availability of blood products should be confirmed by calling the blood bank. Close monitoring of blood loss from the mediastinal chest tubes should be done. Warfarin is an anticoagulant that will increase bleeding. Anticoagulation should be held at this time. Information is needed on the type of valve replacement. For mechanical heart valve, the INR is kept at 2 to 3.5. Tissue valves do not require anticoagulation. Dopamine should not be initiated if the client is hypotensive from hypovolemia. Fluid volume assessment should always be done first. Volume replacement should be initiated in a hypovolemic client prior to starting an inotrope, such as dopamine.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.